If your knee still feels tight or stiff after ACL surgery, even though you've been stretching, there's a reason for that. Stretching and mobility are not the same thing. And knowing the difference between those two could be the difference between feeling stiff and tight at your knee and actually regaining the confidence and the strength that you need. And so by the end of this video, you'll understand what stiffness really means for your knee and how to finally solve that stiffness and tightness. Hi, my name is Josh Arwanto. I'm a physical therapist that specializes in ACL rehab and returning to sport. In this time, I've helped over 200 people get back to sports with full confidence. So let's dive into the video. When I say mobility, the first thing that comes to your mind is probably stretching. Getting full extension and flexion of your knee is absolutely crucial for your ACL rehab. But that's not what we're going to talk about today. We're going to talk about stretching versus mobility. Stretching is usually passive. You're holding a position using some sort of assistance like a wall, a band, or the floor. And you've most likely done some type of stretching in the past. And it feels good, right? It feels good for a couple minutes, even may last a few hours, but after a few hours, your muscles and your body starts to feel tight again. This is why so many people can still feel tight even after years of stretching. The results just don't stick. And here's why. Passive stretching can temporarily, the key word is temporarily, increase the length of your muscles. Without going into the details, the muscles don't actually lengthen, but it just feels like it does. And it feels good. Again, the word is temporary, so only for a short amount of time. And the reason why is because it's passive, your brain doesn't have to register, your brain doesn't have to work to actively hold that movement. So it doesn't teach your brain to fully control and trust that new range. So as soon as you let go of that stretch, your nervous system and your brain doesn't have to remember that pattern. So after a couple hours, your muscles will tighten up again like the way it used to. Now mobility is different. So mobility is strength and stretching. It forces you to hold a certain position while actively holding the muscle activation. You're actively engaging a muscle group to stabilize a joint. So let's take a knee, for example. What are the muscles that attach a knee? Quads, hamstrings, and calves. So what's a way we can activate all those muscles together so that it can make the connections to your brain so that it can remember that pattern and make longer lasting results? You will have better, longer lasting results because your brain actually had to make connections while it's holding that position. We're not just using passive work with a band, a wall, or a floor. That's why mobility work tends to have longer lasting results in terms of reducing your stiffness and your tightness than stretching. So let's zoom in on the ACL rehab portion. We're going to talk about the three most common graft types used to reconstruct an ACL. It's going to be quad tendon, patella tendon, and hamstring graft. For quad and patella tendon grafts, likely the tightness areas are going to be your quads at the bottom of the knee or the back of your knee. This is usually connected to quad inhibition, so your brain's inability to connect and activate the quads. And because those quads aren't fully strong or activated in those positions, the brain and nervous system has a hard time of trusting it, which can lead to tightening and stiffness of that area. Passive stretching alone is not going to solve this tightness. What will make the difference is likely some mobility work that requires activation from your quads, hamstrings, and the calves, which are the muscles again that attach to your knee. So two movements that I like for this are the Bulgarian split squat yielding isometrics and the reverse Nordics. For the Bulgarian split squat isos, you want to get yourself in a good position in that Bulgarian split squat. You want to think about lowering yourself down while lengthening the back leg to make sure you get that full stretch. Now you want to hold that position without your back knee touching the floor. So you're basically holding that position for at least 30 to 60 seconds while staying upright and lengthening through those quads. You should feel a deep stretch in those quads and a very good burn. And this is active mobility. This is active strengthening and stretching at the same time, which will then lead to longer lasting results for your quads. The second one is the reverse Nordics. You want to keep your body in a straight line as much as possible. Don't sink down at the hips. Keep your hips nice and tall. You're going to lower yourself down with control and come back up. Your quads are in a fully stretched position while activating at the same time. This makes really good connections to the brain and nervous system, which allows you to access new ranges and feeling less stiff overall. Now, if you had a hamstring graft, likely your stiffness and tightness could be at the hamstrings. And it makes total sense, right? They took a piece of your hamstrings to reconstruct the ACL. Usually, the hamstrings feel tight and weak, especially in those end ranges. So again, passive stretching is not going to solve the issues for you. We got to do some active mobility work to activate those specific positions. So two things that I like here. I like PNF stretching with the end range hold. So you're going to start off with using a band to pull you into that end range position. Then you're going to loosen up the tension on the band band to let your body and your brain restore that new pattern. And the end range hold is key because this is the time that your brain is actively engaging those hamstrings in those weak positions. The second one is a seated leg curl in the specific range. Instead of just curling the whole way, you're going to focus on the end ranges that are weak and tight. This builds specific strength to that area where it's super weak. And here's the part that most people miss. Mobility work isn't just about reducing stiffness and tightness at the knee. It directly helps with strengthening muscles in specific ranges that are crucial for any type of sport or running. Take decelerating for an example. When we're decelerating, our quads need to be in a lengthened position. So if your quads have never been in that lengthened position holding your body weight on top of it, then you're gonna have trouble decelerating. When we're sprinting, we're also using our hamstrings in a very specific range. Most ACL rehab programs really only address the middle portion of strength, not the end ranges that are weak. So it's important to include these end range training and mobility to make sure you can handle these demands. And that's the connection that mobility work and returning to sport after ACL surgery most programs don't address. So how do we practically do this in your routine? I'm a big believer in that you can sprinkle in these mobility work as part of your normal sessions. You don't need a separate mobility day. You can just sprinkle them in as part of a warm-up, or you can actually embed them in your actual program. But the key here is not to replace your main workouts. So you don't want to replace your bigger movements like split squats, leg extensions, squats, lunges, all that stuff. These mobility exercises are great because they target those specific ranges that your main exercises don't. If you want to see my exact approach on how I've helped over 200 people get back to sports after ACL surgery, I put together a free video training that you can watch right now. And I'll drop that link in the description. So in closing, stretching and mobility are not the same thing. Remember that stretching is passive. It might feel good for a couple hours, but it's not going to last long. Mobility work is strength and stretching, so it's definitely going to make better connections and give longer lasting results. If your knee after ACL surgery is still feeling stiff and weak, you might want to stop stretching and start mobilizing. Whatever situation you're in, keep going, you got this, and I'll see you in the next one.